Hi guys, it's your favorite nurse educator, N.P. Clark, and I'm back with another cup of the morning coffee. In today's cup, I'm going to introduce something that I'm going to start doing on Wednesdays. So yes, the traditional morning coffee is going to be on Mondays. However, on Wednesdays, I want to start doing a morning coffee geared more towards nurses. And the reason why I want to do this is, as a provider with lots of facilities that I service and quite a few patients, I want to help the nurses streamline what they are calling me for. Now, in nursing, there is a form that we use, or we should be using, called an SBAR. SBAR, situation, background, assessment, and recommendation. Nurses, it's important that you guys just familiarize yourself with the form. You don't have to write it down, but the more you train your mind, the easier it will become. I'm going to try and get you all of this information in less than 6 minutes. So, and then as our morning coffees education edition for nurses rolls out every Wednesday at 7 a.m., of course, it's going to be on YouTube, so you guys tune in whenever you like. You can leave comments, questions, other topics, things that you guys would like for me to discuss from the provider standpoint, or from a nurse standpoint, that's fine. So let's get started. So the SBAR. This is something that nurses should use when they are calling the provider, whether that's the physician's assistant, the physician, or the nurse practitioner. Whoever you are calling to get orders, or there's been a change in condition. Maybe a patient was walking this morning and now all of a sudden they can't walk, or they're complaining of pain, shortness of breath, things like that. So, situation, which is the S in the SBAR. This is where you want to not only notify the provider of who you are, where you're calling from, and who the patient is. It's imperative that you state this information. Where you guys are responsible generally for one building, most providers have multiple buildings. So like myself, I have about 14 buildings, I think. So I don't know everybody, and at times, depending on what's happening, I might be busy, but I want to take that call for you. Please let me know where you're calling from and who you are and who the patient is. Then also in the situation, tell me, what is the situation? What's happening? Is the patient short of breath? How long have they been short of breath? How severe is it? Is it just they went outside to have a cigarette and now they're back in the facility and they're short of breath? Or was it a quick onset? Really get in there and explain what is happening. Tell me about the situation. B is for background. So the background, tell me everything pertinent to what's happening. The patient has a diagnosis of COPD. The patient has a history of smoking and currently smokes. The patient has a history of pulmonary embolisms. See where I'm going with that? So you want to tell the provider everything that is pertinent to the current situation. What I mentioned, if the patient is diabetic or has hypertension, sure, but it's not. If there are diagnoses or situations that are directly tied to the current situation that you're calling me about, please tell me what those things are. Tell me about the labs. What current labs do they have? Maybe they were hospitalized a month ago and had ABGs or arterial blood gases, or was there any other labs, CBC, CMP, any of those things that were ordered? But tell me what's going on. Again, if they were hospitalized, maybe they were just in the hospital a week ago. Tell me, especially for shortness of breath, are they currently on oxygen? If they are not currently on oxygen, obviously we know basic nursing, apply oxygen to the patient in the interim while you're calling to get the order. A, assessment. So your assessment, this is your assessment of the patient. You should be calling with an assessment already completed. This means vital signs, current visual assessment, head to toe of what's happening. Have you listened to the patient's lung sounds? Have you Is the patient coughing? Maybe the patient is on an altered diet, but they ate regular food. Things like that. Or, as I said before, the patient just went out and they were smoking and now they've returned and they're short of breath. Or they refused their inhalers. Things like that. Okay? Now, final recommendation. This recommendation is, what are you calling me for? What would you like to have done? Many nurses, they come up with their own plan of care. So when they call me, it's almost like a think tank. We are talking back and forth, and you guys know the patients better than most of the providers because you're in the facility. So is this something that John Doe does every day? He goes out to smoke and then he says that he has shortness of breath, and he really does, and that's fine. So maybe we need to alter what his treatments are. If he's always on 2 liters of oxygen and he's still complaining of shortness of breath, maybe we need to increase that. So again, the recommendation is, what are you looking to be done? Is this patient in such a dire situation that the patient needs to be sent to the hospital? So those are the things that we would like to hear from you. And then, of course, that's not on the form, you're going to get our response. And generally, I ask a lot of questions as a nurse practitioner because I like to be a little thorough, and I was a nurse. I was a registered nurse too, and I've worked the floor numerous years, so that's why I ask. It's not to question you, it's to make sure that we've covered everything and to be thorough. So this has been an explanation on the SBAR and what providers are looking for. So please, when you guys call us, make sure that you inform us of what the situation is, give us a little background, provide your assessment, and then what's your recommendation, or what is it that you're needing from us. So this has been MP Clark with an SBAR update on the Morning Coffee, guys. Thanks for joining. Be sure to like and subscribe and share. Thank you.